I've been treating seniors with chronic back pain for over 25 years, and I need to tell you something that might surprise you. That stabbing pain you feel every morning when you roll out of bed, that stiffness that makes you move like you're 90 when you're only 65, it doesn't have to be your new normal. Most people over 60 believe lower back pain is just something you have to live with as you age. But that's not true. The real problem isn't your age. It's what happens to your spine while you sleep, and what you do or don't do in those first critical minutes after waking up. Here's what most doctors won't tell you. Your spine loses flexibility overnight. Your muscles tighten. Your discs compress. And when you immediately stand up and start moving without preparation, you're setting yourself up for pain that can last all day, or worse, lead to injury that puts you in bed for weeks. But here's the incredible news. There are 5 simple morning stretches, backed by physical therapy research, that can relieve your lower back pain in as little as 10 minutes. These aren't complicated yoga poses or exercises that require you to get down on the floor. These are gentle, safe movements you can do right in your bed or while sitting on the edge of your mattress. And they work. In this video, I'll walk you through each stretch step by step, exactly as I teach my patients in the clinic. By the end, you'll know precisely how to wake up your spine, release tension, and start your day with less pain and more mobility. And wait until you see stretch number 3. Physical therapists call it the spinal reset, and studies show it can reduce morning back pain by up to 60% when done consistently. Most seniors have never even heard of it. But after today, you will. All medical references and research studies I mention are listed in the description below. Before we begin, here's a quick question. How long have you been dealing with lower back pain? Drop a number in the comments. Is it months? Years? Decades? I personally read and respond to every comment like we're sitting in my clinic together, so don't hold back. Now, without any further delay, let's dive into stretch number 5, the perfect movement to begin awakening your spine after a night of sleep. Stretch number 5, knee to chest. Stretch releases tension in the lower back and hips. The very first stretch you should do every morning, even before you sit up, is the knee to chest stretch. This movement is designed to gently decompress your lower spine and release the tension that builds up in your hips and lower back overnight. Why does this matter so much? During sleep, your spine remains relatively stationary for 6 to 8 hours. The natural curves in your back compress, especially in the lumbar region, the lower 5 vertebrae that bear most of your body weight. Meanwhile, your hip flexors, the muscles that connect your thighs to your lower spine, tighten and shorten. When you wake up and try to stand immediately, these tight muscles pull on your spine, triggering pain. Research published in the Journal of Physical Therapy Science found that knee to chest stretches significantly improved lumbar flexibility and reduced pain intensity in older adults with chronic lower back issues. One study showed that participants who performed this stretch daily for 4 weeks reported a 40% reduction in morning stiffness. The science is clear. This simple movement creates space between your vertebrae, stretches your glutes and hip flexors, and signals your nervous system to relax the muscles guarding your spine. Here's exactly how to do it safely and effectively. While lying flat on your back in bed, keep your left leg extended straight. Bend your right knee and slowly bring it up toward your chest. Use both hands to gently pull your knee closer, but only as far as feels comfortable. You should feel a gentle stretch in your lower back and buttock, not sharp pain. Hold this position for 20 to 30 seconds while breathing deeply and steadily. Then slowly release your right leg back to the starting position and repeat with your left leg. Do this stretch 2 to 3 times on each side. One 68-year-old retired teacher I worked with had suffered from severe morning back pain for over a decade. She could barely stand up straight for the first hour of her day. After I taught her this simple stretch, and she committed to doing it every single morning before getting out of bed, she came back to my clinic 3 weeks later, almost in tears. She told me it was the first time in years she could stand up without grimacing. The pain wasn't completely gone, but it had dropped from an 8 out of 10 to a 3 out of 10. That's life-changing. Here's the key mistake most seniors make with this stretch. They rush it. They yank their knee toward their chest or bounce the movement, thinking that will make it more effective. That's dangerous. Your spine is stiff in the morning, and aggressive movements can strain muscles or even pinch nerves. Think of your lower back like cold taffy. You have to warm it up slowly before it stretches. Gentle, sustained holds are what create lasting relief. Another mistake is holding your breath. When you hold your breath, your muscles tense up, which defeats the purpose. Breathe slowly and deeply throughout the stretch. Each exhale should help you relax a little more into the movement. This stretch is your foundation. It prepares your spine for the day ahead and sets the tone for pain-free movement. But to get even deeper relief, you need to target the muscles along your entire lower back and hips. That's where stretch number 4 becomes essential. Stretch number 4, pelvic tilt. Strengthens core and relieves lower back tension. Once you've gently stretched your hips and lower back with the knee to chest movement, the next step is to activate and stabilize the muscles that support your spine. That's where the pelvic tilt comes in. This stretch might sound simple, but don't underestimate it. Physical therapists consider the pelvic tilt one of the most effective exercises for relieving lower back pain because it does two things at once. It gently stretches the muscles in your lower back while strengthening your core, the deep abdominal and pelvic muscles that act like a natural brace for your spine. Here's why this matters, especially after 60. As we age, our core muscles weaken. We lose muscle mass, spend more time sitting, and our posture deteriorates. When your core is weak, your lower back has to work overtime to support your body weight, and that overuse leads to chronic pain, stiffness, and even injury. A study in the Clinical Journal of Pain found that seniors who performed pelvic tilts daily experienced significant reductions in lower back pain and improved their ability to perform everyday activities like bending, lifting, and walking. The pelvic tilt teaches your body how to move your spine safely and trains the muscles that prevent future pain. Here's how to perform it correctly. Lie flat on your back in bed with your knees bent and feet flat on the mattress, hip width apart. Place your arms relaxed at your sides. Now focus on your lower back. You'll notice there's a small gap between your lower back and the mattress. That's the natural curve of your spine. The goal of this stretch is to gently flatten that curve by tilting your pelvis. To do this, tighten your abdominal muscles and gently press your lower back down into the mattress. Imagine you're trying to push your belly button toward your spine. As you do this, your pelvis will tilt slightly upward. You should feel your lower back flatten against the bed, and a gentle contraction in your core muscles. Hold this position for 5 to 10 seconds while breathing normally. Then release and let your spine return to its natural curve. Rest for a few seconds, then repeat. Aim for 10 to 15 repetitions. The movement should be slow and controlled, not forced. You're not trying to lift your hips off the bed. You're simply rocking your pelvis to engage your core and stretch your lower back. I once treated a 72-year-old retired postal worker who had developed severe lower back pain after years of walking mail routes and lifting heavy bags. By the time he came to see me, he could barely bend over to tie his shoes. I taught him the pelvic tilt as part of his morning routine, along with a few other stretches. Within 6 weeks, his pain had decreased by more than half, and he told me he felt stronger and more stable than he had in years. He said it was like his spine finally had the support it needed. Here's the critical mistake most people make with this exercise. They try to force the movement by lifting their hips or using their leg muscles instead of their core. That defeats the purpose. The pelvic tilt is a subtle movement. It should feel like a gentle squeeze in your lower abdomen, not a full body effort. If you're not sure you're doing it right, place one hand on your lower belly and one hand under your lower back. When you tilt your pelvis correctly, you should feel your belly tighten and your lower back press into your hand. Another common error is holding your breath. Breathe steadily throughout the movement. Tension in your breath creates tension in your muscles, and that makes the stretch less effective. The pelvic tilt is a powerhouse move. It stabilizes your spine, reduces pain, and builds strength that protects you throughout the day. But now that your core is engaged and your lower back is loosening up, it's time to stretch the muscles that run along the sides of your spine. That's where stretch number 3, the spinal reset, changes everything. Stretch number 3, spinal twist, the spinal reset. Increases mobility and reduces stiffness. If there's one stretch that physical therapists swear by for relieving chronic lower back pain, it's the spinal twist. This is the stretch I mentioned earlier, the one researchers call the spinal reset. And for good reason. The spinal twist targets the deep rotational muscles along your spine, muscles that get locked up overnight and restrict your ability to move freely during the day. When these muscles are tight, every movement, whether it's reaching for something, turning to look behind you, or even walking, puts extra strain on your lower back and triggers pain. Here's what makes the spinal twist so powerful. It gently rotates your spine, stretching the muscles and fascia, the connective tissue that wraps around your muscles on both sides of your back. This rotation also increases circulation to the spinal discs, the cushions between your vertebrae, helping them rehydrate and decompress after a night of being compressed. A clinical study published in the Journal of Orthopedic and Sports Physical Therapy found that spinal rotation stretches improved range of motion and reduced pain intensity in adults over 60 with chronic lower back issues. Participants who performed this stretch daily reported a 60% reduction in morning stiffness within just 4 weeks. Let me tell you about a 74-year-old woman I treated who couldn't turn her torso without sharp pain shooting down her lower back and into her hip. She had stopped driving because she couldn't check her blind spot without agony. After I introduced her to the spinal twist and she practiced it every morning, she came back a month later and told me she felt like she had a new spine. The pain was nearly gone, and she was driving again, independently and pain-free. Here's how to perform the spinal twist safely and effectively. Lie flat on your back in bed with your arms stretched out to the sides, forming a T shape. This helps stabilize your upper body. Bend both knees and plant your feet flat on the mattress, close to your buttocks. Now, keeping your shoulders flat against the bed, slowly lower both knees together to your right side. Let them drop as far as is comfortable. You should feel a gentle stretch along the left side of your lower back and possibly into your hip. Turn your head to the left, in the opposite direction of your knees. This increases the stretch along your spine. Hold this position for 20 to 30 seconds, breathing deeply and allowing your muscles to relax into the stretch. Then, slowly bring your knees back to the center and repeat on the other side, lowering your knees to the left and turning your head to the right. Do this stretch 2 to 3 times on each side. The key is slow, controlled movement. Don't force your knees all the way to the bed if it causes pain. Let gravity do the work. Over time, as your flexibility improves, you'll be able to stretch deeper. Here's where seniors go wrong with this stretch. They twist too aggressively or bounce their knees, trying to force a deeper stretch. That's dangerous. Your spine is not warmed up yet, and sudden twisting motions can strain muscles or irritate spinal nerves, especially if you have arthritis or disc issues. The spinal twist should feel like a gentle release, not a struggle. Another mistake is lifting the shoulder on the side you're twisting toward. Keep both shoulders flat on the bed. If one shoulder lifts, you're losing the benefit of the stretch. One more thing. If you have severe sciatica, herniated discs, or spinal stenosis, check with your doctor or physical therapist before doing this stretch. For most people, it's perfectly safe and incredibly effective. But if you have structural issues in your spine, you may need a modified version. The spinal twist is a game changer. It restores mobility, releases deep tension, and gives your spine the freedom to move without pain. But to complete your morning routine, you need to stretch the muscles that connect your lower back to your legs. That's where stretch number 2 comes in. Stretch number 2, hamstring stretch, relieves pressure on the lower back. Most people don't realize this, but tight hamstrings, the muscles running down the back of your thighs, are one of the leading causes of chronic lower back pain in seniors. Here's why. Your hamstrings are directly connected to your pelvis. When they're tight, they pull your pelvis downward and backward, which flattens the natural curve of your lower spine and puts enormous strain on your lower back muscles and spinal discs. Over time, this misalignment leads to pain, stiffness, and even injury. Research published in the Archives of Physical Medicine and Rehabilitation found that seniors with chronic lower back pain had significantly tighter hamstrings compared to those without pain. More importantly, the study showed that regular hamstring stretching reduced lower back pain by an average of 50% over 8 weeks. The connection is clear. Flexible hamstrings mean less stress on your lower back and fewer days spent in pain. I treated a 66-year-old man who had been living with lower back pain for nearly 15 years. He had tried everything: pain medications, heating pads, expensive ergonomic chairs. Nothing worked. When I assessed his flexibility, I found his hamstrings were so tight, He could barely bend forward past his knees. I prescribed a simple daily hamstring stretch as part of his morning routine. Within 2 months, his pain had dropped from a constant 7 out of 10 to a manageable 2 out of 10. He told me he wished someone had explained this connection to him years ago. Here's how to safely stretch your hamstrings first thing in the morning. You can do this stretch right in bed. Lie flat on your back with both legs extended. Bend your right knee and bring it toward your chest, then straighten your right leg up toward the ceiling as much as you comfortably can. Keep your left leg flat on the bed. If you can, gently hold the back of your right thigh or calf with both hands and pull your leg slightly closer to your chest. You should feel a stretch along the back of your right thigh. If your hamstrings are very tight, don't worry if your leg doesn't straighten completely. Just go as far as you can without pain. Hold the stretch for 20 to 30 seconds, breathing deeply and steadily. Slowly lower your right leg back to the bed and repeat with your left leg. Do this stretch 2 to 3 times on each side. The goal is not to force your leg into a perfect vertical position. The goal is to feel a gentle, sustained stretch in the back of your thigh and to gradually increase your flexibility over time. Here's the biggest mistake seniors make with hamstring stretches. They bounce or jerk their leg, thinking that will help them stretch deeper. That's not only ineffective, it's dangerous. Bouncing activates a protective reflex in your muscles called the stretch reflex, which causes your muscles to contract instead of lengthen. Worse, it can lead to muscle strains or tears, especially in older adults whose tissues are less elastic. Always stretch slowly and hold the position. Think of it like pulling taffy. Slow, steady tension creates length. Quick jerks cause it to snap. Another mistake is holding your breath or tensing your shoulders and neck. When you do that, your entire body tightens, and the stretch becomes less effective. Focus on breathing deeply and relaxing every part of your body except the leg you're stretching. If you find it difficult to hold your leg up with your hands, you can use a towel or a belt looped around your foot to assist. Simply hold the ends of the towel and gently pull your leg toward you. This gives you more control and prevents strain in your arms and shoulders. Hamstring flexibility is one of the most underrated keys to a pain-free lower back. By stretching them every morning, you're taking pressure off your spine and giving your back the freedom to move the way it was designed to. But there's one more stretch, the final piece of the puzzle, that ties everything together and prepares your entire spine for the day ahead. Let's move to stretch number 1. Stretch number 1, cat-cow. Stretch, modified for bed, mobilizes the entire spine and reduces morning stiffness. The number 1 stretch every senior should do to relieve lower back pain is the cat-cow stretch. Physical therapists and chiropractors call this the ultimate spinal mobility exercise because it gently moves every segment of your spine through its full range of motion, from your neck all the way down to your tailbone. This is critical in the morning because your spine has been locked in one position all night. The discs between your vertebrae are compressed, the muscles along your back are stiff, and your joints are tight. The cat-cow stretch reverses all of that. It pumps fluid back into your spinal discs, stretches, and strengthens the muscles supporting your spine, and restores the natural curves in your back. A landmark study in the Journal of Back and Musculoskeletal Rehabilitation found that seniors who performed the cat-cow stretch daily experienced significant improvements in spinal flexibility, reduced pain, and better posture within 6 weeks. Researchers noted that this stretch was particularly effective for people over 60 because it's low impact, requires no equipment, and can be easily modified for those with limited mobility. Let me share a story. I once worked with an 81-year-old woman who had been hunched over for years due to chronic back pain and arthritis. She was convinced she would never stand up straight again. I taught her a modified version of the cat-cow stretch that she could do while sitting on the edge of her bed. After just 2 weeks of daily practice, she stood taller, moved more freely, and told me she felt 20 years younger. She said it was like someone had oiled her spine. Now, the traditional cat-cow stretch is done on your hands and knees, but many seniors find that position uncomfortable or difficult to get into, especially first thing in the morning. So I'm going to teach you a modified version you can do right on the edge of your bed. This version is just as effective and much easier on your joints. Here's how to do it. Sit on the edge of your bed with your feet flat on the floor, hip width apart. Place your hands on your thighs for support. Sit up tall with your shoulders back. Now, take a deep breath in, and as you inhale, gently arch your lower back, Push your chest forward and lift your chin slightly toward the ceiling. This is the cow position. You should feel a gentle stretch across the front of your body and a slight compression in your lower back. Hold this position for 2 to 3 seconds. Then, as you exhale, do the opposite. Round your lower back, tuck your chin toward your chest, and pull your belly button in toward your spine. This is the cat position. You should feel a stretch along your entire spine, from your lower back up to your neck. Hold this position for 2 to 3 seconds. Move slowly and smoothly between the two positions, matching your breath to your movement. Inhale as you arch into cow, exhale as you round into cat. Repeat this movement 10 to 15 times. The rhythm should feel natural and flowing, like a gentle